Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're continuing our inhaler series for asthma. Asthma is one of the most common allergic diseases affecting both children and adults, and inhalers remain the cornerstone of treatment. They are widely used, well studied, and proven to be both safe and effective. While I have previously covered nearly all FDA-approved biologic therapies for asthma, this series shifts our focus back to inhalers, introducing them one by one. In this episode, we're focusing on Alvesco, an inhaled corticosteroid that delivers extra fine particles to reach both large and small airways, where the inflammation occurs in asthma. It is designed to act primarily in the lungs while keeping overall exposure to the rest of the body low. It is approved for patients 12 years of age and older and comes in two strengths, with flexible dosing depending on prior therapy and disease severity. In this video, I'll walk you through 5 key things you need to know about Alvesco: what it is, how it works, how to use it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Alvesco and who it's for? Alvesco contains Ciclesonide, an inhaled corticosteroid approved by the FDA in January 2008 as the maintenance treatment for the prevention and control of asthma in adults and adolescents 12 years of age and older. It is important to remember that Alvesco is not a rescue medication. It should not be used to treat acute breathing symptoms or asthma attacks. Instead, it is taken regularly to reduce airway inflammation, improve lung function, and lower the risk of flare-ups over time. Patients should always have a separate rescue inhaler available for quick relief when needed. Second, how does Alvesco work? Alvesco contains Ciclesonide, a corticosteroid that targets the underlying inflammation in asthma. Asthma is not just about narrowed airways. It is also driven by ongoing inflammation. Corticosteroids help calm this inflammation by reducing the activity of immune cells and inflammatory signals involved in both allergic and non-allergic asthma. Because Alvesco is delivered directly into the lungs, it works where it's needed most, while overexposure to the rest of the body remains low. It's also important to set expectations. The onset and degree of symptom relief can vary between patients. Some improvement may be noticed earlier, but full benefit may take up to 4 weeks or longer with consistent use. Third, let's talk about dosing and how to take Alvesco. Alvesco is taken twice daily by oral inhalation, ideally at regular intervals. It comes in two strengths, 80 and 160 micrograms per inhalation. For patients 12 years and older who are not already using an inhaled corticosteroid, the recommended starting dose is 80 micrograms twice daily with adjustments based on response. For patients switching from another inhaled corticosteroid, their starting dose is also 80 micrograms twice daily, with further adjustments depending on prior therapy and disease severity. For patients transitioning from oral corticosteroids, higher starting dose, such as 320 micrograms twice daily, are recommended. The oral steroid should be tapered gradually under medical supervision, with close monitoring for worsening asthma symptoms or signs of adrenal insufficiency. For patients who do not respond adequately after 4 weeks of therapy, the dosage may be increased under a doctor's guidance to provide additional asthma control. The maximum recommended amount for patients 12 years and older is 320 micrograms twice daily, although patients may be managed at lower doses. If asthma symptoms do not improve or worsen despite treatment, patients should contact their healthcare provider to reassess and adjust the management plan. Once good control is achieved, the goal is to step down to the lowest effective dose to minimize potential side effects. Proper inhaler use is essential. Correct priming and inhalation technique are key to ensure the medication reaches the lungs and provides full benefit. Detailed instructions are available in the instruction for use section of the package insert and on the official website. Fourth, let's review important warnings and precautions. Hypersensitivity reactions, including anaphylaxis, may occur. If symptoms such as trouble breathing, hives, or swelling of the lip, tongue, and throat occur, stop the medication immediately and seek emergency medical care. Sudden worsening of breathing, coughing, and wheezing, known as paradoxical bronchospasm, can occur with inhaled medications. If this happens after using Alvesco, treat it right away with a rescue inhaler. Alvesco should be stopped immediately and alternative treatment should be used. Because Alvesco contains a corticosteroid, it may affect the immune system and increase the risk of infection. Contact your healthcare provider if you develop signs of infection, such as fever, chills, worsening fatigue, new pain, nausea, or vomiting. Patients should avoid exposure to contagious illnesses like chickenpox or measles and discuss any past infection or exposure with their doctor. Inhaled corticosteroids should be used with caution in people with current or past tuberculosis, untreated systemic fungal, bacterial, viral, or parasitic infections, or herpes infection of the eye. In addition, inhaled corticosteroids can cause a fungal infection in the mouth or throat, called thrush. Rinse your mouth with water and spit it out after using Alvesco to reduce this risk. If thrush develops, treatment may include antifungal therapy and temporarily stopping Alvesco. Using Alvesco at high doses or together with other steroid medicines for asthma, allergies, or skin conditions may increase the risk of systemic steroid effects, including hypercorticism and adrenal suppression. Patients should be checked for other steroid use and monitored for these effects, and treated if they occur. If you're switching from another steroid regimen, such as systemic corticosteroids, to Alvesco, the transition needs to be managed carefully. Rapidly tapering or stopping a higher dose of steroid and moving to Alvesco may cause symptoms of steroid withdrawal or adrenal insufficiency, or allow previously stabilized conditions like asthma to flare. Your doctor may choose to taper the prior steroid gradually and monitor for symptoms while introducing Alvesco. Long-term use of inhaled corticosteroids like Ciclesonide may contribute to the development or worsening of glaucoma and cataracts. Patients who develop eye symptoms or with a history of eye problems, including elevated eye pressure, glaucoma, and cataracts, should have regular eye exams while using Alvesco. Any new or worsening vision changes should be evaluated promptly. Prolonged use of inhaled corticosteroids may also lead to bone weakness. While the impact of small changes is unclear, people at higher risk, such as older adults, postmenopausal women, smokers, those with poor nutrition, limited mobility, a family history of osteoporosis, or long-term use of medications that cause bone thinning should be monitored for bone loss and treated if needed. Lastly, corticosteroid use may slow growth in children. Pediatric patients should be kept on the lowest effective dose needed to control symptoms, and growth should be monitored regularly during treatment with Alvesco. And finally, let's review the side effects and safety. In clinical trials of adults and adolescents ages 12 and older, using the 80 and 160 microgram strength of Alvesco, the most commonly reported side effects were headache, joint pain, nasal congestion, sore throat, upper respiratory infection, swelling of the nose, sinus, and throat, and pain in the arms, legs, and back. Longer-term studies extending up to about 1 year showed a consistent safety profile without new safety concerns. After approval, additional adverse events have been reported through post-marketing experience with Alvesco. Although it is difficult to determine how often these occur or whether they are directly caused by the medication, these reports highlight the importance of stopping the inhaler and consulting a healthcare provider if new, persistent, or worsening symptoms develop. And there you have it, 5 key things to know about Alvesco, an inhaled corticosteroid with extra fine particles designed to reach both large and small airways, helping control inflammation in the lungs while minimizing systemic exposure and supporting long-term asthma management. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.